joining. I'm very pleased to welcome you all here this evening to hear our guest speaker, Dr. Justin Carrero. And I'll introduce Justin now when he's back, but I'm very pleased to say that we're joined as well this evening by Miss Nicola Koss from ADHD Ireland, who is here in Ken's Place this evening. So it's lovely to have a new person join us, Nicola, so you're very welcome.
Thank you very much. I was looking forward to it.
Brilliant. And then, of course, we have Beth from the College of Health and Agricultural Sciences. Beth has lost her voice this evening. Well, an IT issue, so let's see. Hopefully we'll hear from her a little later. But without further ado, just to introduce Justin. So Justin is an independent management consultant specializing in workplace inclusion for neurodivergent people. He completed a Master of Business Administration at the University of Queensland in Australia and is currently a PhD candidate with Monash University, also in Australia, focusing on how to facilitate an inclusive workplace for neurodivergent and neurodiverse individuals when accounting for the intersectional differences which can be evident, such as gender. So Justin is somebody that we would have linked up with over the summer, and I know you're well traveled, Justin, originally from the States and hopefully coming to Europe as well. So our last speaker as well was looking at the issue of recruitment and also inclusive HR practices. So we're really interested to continue with this theme, hearing from yourself. So as I say, I'll hand over to you, and I might mute myself, and I might even turn off my camera, and I look forward to your talk.
Sure. Well, thank you very much, and thank you everyone for being here. It is an absolute pleasure and honor to be here. As Tim mentioned, we had a chance to connect earlier this year, and when they had shared more information about the Masterclass, I said, this sounds absolutely incredible. So thank you very much. I'm going to go ahead and share my screen, and give me just 1 second here. So I think we tested this earlier, so it should be coming through okay, but if there's any issues or anything, please feel free to let me know. But first and foremost, again, thank you all for being here. So to kind of give you a little bit of an idea as to what's going to take place today, I'm first going to provide a little bit of an introduction around as to who I am. Then I'm going to provide a little bit more of an overview of thinking about neurodiversity in terms of a model, in terms of how does this compare to a more influential perspective, such as the medical model, and what is different and unique about this. From here, I'm then going to dive a little bit more into the importance of discussing intersectionality with a particular focus on gender. Now, as Tim kind of started to share, my PhD does focus on neurodiversity inclusion with a particular focus on intersectionality. And I think this section is going to be really interesting for many individuals in understanding how just by isolating a topic as simple as gender can really start to elucidate a whole new perspective and understanding. From here, I'm then going to kind of dive a little bit more into the role of inclusion. Now, inclusion is something that I've kind of taken much more of an interest in because as Tim mentioned, the previous speaker had focused on hiring and integration. And this was a topic I focused on early on in my career from a research perspective as well. However, I then transitioned to inclusion because what I found about that is that it was an area that was able to touch on every aspect of an organization, irrespective if it's a for-profit organization or perhaps an educational institution. Now from here, I'm just going to include some practical ideas that kind of like how you can create an inclusive workplace. Now, these are going to be a little bit more high level. That was intentional to make it more transferable because some of them can change based on the industry and the geographical location. However, I will be including my contact information at the end of the presentation in the event you work in the HR space, or perhaps you're wanting to participate in some of the ongoing research that's taking place. So I'll share more information on that later. And then of course, it will conclude with a Q&A. So just to go ahead and dive in. So as mentioned, excuse me. So as mentioned, my name is Justin. Now, something that I don't typically share publicly, in terms of when I say publicly, I mean in areas such as LinkedIn and things of that nature, but I feel it's really important to share in a context such as this, is that I'm actually ADHD. Now, it's something I share pretty openly in presentations such as this, because when it comes to topics that are sensitive, such as discussing neurological conditions or the context of intersectionality, oftentimes these have come from individuals or scholars who may not have offered a lived experience from that perspective. And so this is something I wanted to be transparent about pretty early on, in saying this is how I've started to fit into all of this. Now, as mentioned early on by Tim, my background is more management consulting. So when it comes to research, I do adopt a little bit more of a practitioner lens to say, well, aside from the theoretical contributions we can make that would contribute to the classroom environment, what are some things that we can take to the workplace today? And something that's a little bit more practical, insightful. And as Tim mentioned as well, I'm originally from Chicago. I'm currently based in Australia. However, I do occasionally visit different parts of Europe for engagements and lectures. So there is a secondary trip that's happening early next year that I'm going to be sharing more later on as well. So to kind of just dive right in. So when thinking about the medical model, which is by far the most influential and prominent model that exists when it comes to discussing any sort of neurological condition or disability for that matter. So through this lens, it inherently seeks to identify a perceived hardship. Now, through this perspective, disabilities are inherently depicted or viewed as a biological abnormality. Now, as influential and as prominent this model has been, historically speaking, there are some limitations to it. In particular, when we have a model that focuses predominantly on a perceived deficit, it then overlooks the counteractive natural capability that could be associated with that particular condition. So in thinking about that, this is inherently how the social model of disability emerged. It directly challenged the medical model on the basis that the disability itself does not fall on the individual in itself. Rather, it actually falls on society and the environment in which an individual lives. So to give you a practical example, think about the neighborhood in which you live or the city in which you work. Think about how easy or difficult, if let's say you had an individual in a wheelchair, how many places could they access? Homes, buildings, retail stores. For many of us, we live in cities that were built several years ago that haven't really changed too much. And so when we really think about how many areas of a place we live that is actually not that was never designed for the accessibility of everyone, it starts to elucidate this different type of picture that perhaps there's other things we could be doing to create a more inclusive place. And that was inherently what drove the social model. Now, in saying that, a limitation to this is pretty similar to the example that I just gave, is that the social model of disability inherently just centered on physical conditions. It did not account for neurological, such as autism or ADHD. So, introduced the neurodiversity model, it is inherently positioned between the medical and the social model and adopts more of a socio-political approach. Now, through this lens, it inherently argues that a standard model of brain development does not exist. And when we really think about this, medically speaking, when we start to look at what is considered normal versus abnormal behavior, it operates under this assumption that we have some kind of baseline of how you are supposed to neurologically develop. However, medically speaking, we do not have a standard measurement of how a brain is supposed to exist. So that was inherently a key element of this foundation. Then, along with the idea that the natural variation that takes place within a human being is a natural evolutionary occurrence. Now, it inherently argues that it's a form of biodiversity that should be politically recognized in a manner as similar to race or gender, hence neurodiversity. Now, in thinking about this, I want to introduce a concept that was an image that was first designed by a very wonderful colleague of mine named Dr. Lutza Ireland. Now, this right here is what's referred to as a typical cognitive profile. You will see how there's different key performance areas that we often can measure, such as an individual's attention to detail, memory, and problem solving. And you'll notice on the outer ring, it has a little bit of a lighter blue color, and then followed by green, and then more of a pink in the middle. This is meant to represent an above average capability with the blue, followed by the pink representing a below average capability. Now you'll notice that within the middle in the green, there's certain areas where it's a little bit kind of gravitating more towards the blue, and then other areas where it's gravitating a little bit more towards the pink. Now, this is not to be representative of every individual who does not have a neurological condition, but rather to illustrate that there's natural strengths and natural variations that can exist in someone's key capabilities. This is more representative of about 80% of the population, also referred to as the neurotypical population. Comparatively, however, for a neurodistinct or neurodivergent profile, you tend to see a little bit more of a spike and stronger variation, where you're going to see above average capabilities in areas such as problem solving or attention to detail, but perhaps a below average capability in areas such as social interaction or memory recall. Now, what's unique about this is that oftentimes we have historically treated this as a form of a disability by saying you're inherently limited in one area, so therefore you have a disability. When in reality, we were overlooking key strengths as well that somebody may naturally have. So with this type of profile, it's typically observed in about 20% of the population. And it is worth mentioning that this is not to be taken as representative of every single neurodivergent individual. This is just to illustrate a type of profile that can emerge. Now, in saying that, thinking about the importance of intersectionality now. So in saying this, professionally and socially speaking, autism has often been referenced as a collective single identity, such as the autistic population, the autistic community. Now, in saying this, we inherently make an assumption along the way that autism can be generally categorized when we talk about it and say, well, this is indicative of everyone. However, autism is not the only identity that individuals have. Very similarly to kind of what I shared early on with disclosing that I have ADHD, that's not the only identity I have. So we also have other identities: gender, race, or ethnicity, our country of birth, which kind of accounts for that cultural influence, our sexual orientation. So in saying this, the focus of this presentation, however, is going to center on gender, which is distinctly different from biological sex, in that biological sex centers more around the anatomical features based on the anatomical features that are assigned at birth, versus gender is more of the behavioral, cultural, and social characteristics associated with one's biological sex. So to give you a practical example of what I mean with that, growing up, many of us received some type of social messaging about how we were supposed to dress, how we were supposed to act, the types of interests we should have, the types of interests we should avoid, based on our assigned sex. For example, growing up, I was often told that certain colors were more masculine and something that was more appropriate for boys, versus for girls, it was supposed to be different types of colors. Those are the types of social messaging that I'm referencing that we received as adolescents that had an influence in understanding how we are supposed to project our perceived gender. Now, in saying this, I'm going to introduce the medical classification of autism for just a moment. So autism is this condition that is characterized as this neurodevelopmental condition that's observationally distinguished by behavioral differences with several areas, but three of the most commonly referenced are differences with social interaction, verbal communication, as well as repetitive behaviors or restricted interest. Now, here's what's so important about intersectionality in this context, is that when we think about these behaviors right here, which are, again, the hallmark characteristics around autism, we inherently assume that this is representative of anyone who has autism. Well, there's something I want you to pay attention to in this definition. You'll notice that italicize the word observationally, because you'll notice with these characteristics, all of these center on what the role of the physical body is doing. None of them actually center on anything that's happening neurologically, even though we categorize the condition as neurodevelopmental. This is a bit problematic when we start accounting for something like gender. And the reason why is this, is that autistic males are actually much more likely than females to externalize their behavior. Females, however, are much more likely to internalize it. That becomes, from a diagnostic perspective, that becomes a little bit problematic, because if we're relying our diagnosis on an observational detection, that's going to make it much harder for females to be diagnosed accurately because it requires them to externalize a behavior. However, what we're finding is that they are much more likely to internalize it. And additionally, what's been found so far is that males are much more likely to display repetitive and restricted behaviors. Now, additionally, what's interesting is that autistic females are less likely to display nonverbal communication differences as a result of what's referred to as the social reward pathway developing differently. Now, I'm willing to bet many of us here today have probably never heard of what's referred to as the social reward pathway. So I pulled in an image to kind of be able to show you it actually. So what you're looking at is an MRI brain scan of a neurotypical adolescent, and the wide red area that you're kind of seeing at the top that kind of splits off, that is the social reward pathway. So what happens is that when we engage in some kind of social interaction, and let's say it could be with a friend, colleague, family member, anyone, if you're enjoying that conversation, if you are finding some kind of perceived value in it, perhaps you're catching up with a friend, perhaps you're networking at an event. If you understand the value of that conversation and you're having some kind of enjoyment out of it, your social reward pathway becomes activated. Now, comparatively, in a neurodivergent adolescence, what's been found is that it's actually become a little bit more restricted. And so what's taking place is that it's not always the messages of why the value should be, what the value in the conversation is not necessarily being being received. So there's one thing to this, however, is that what we're with this development with neurodivergent adolescents, we are not seeing that across the board for both males and females. In fact, what we are seeing for autistic females is that they are developing much more like the neurotypical adolescent, in that their social reward pathway is not being affected at all. Now, this is not the case for every autistic female. It's just what we've started to observe in a sizable segment of the population. Now, in thinking of returning back to the diagnostic focus, however, considering that repetitive and restricted behaviors, as well as differences with social interaction and communication, are hallmark characteristics of the diagnostic process. And if these are not being displayed as likely by females, this raises questions around the validity and accuracy of the diagnostic process itself. And so what's then been found is that autistic females are much less likely to receive an accurate diagnosis compared to males, even when their symptoms are just as severe. Now, what's interesting, however, and this is also recognized in the DSM, which, excuse me, is that unless an intellectual impairment is present, an observational diagnosis is much less likely to take place. So now, in thinking about this has pretty profound implications in the context of research. And the reason why is because diagnostic criteria and research sampling are interactive in effect. And so what I mean is in many instances, it's quite common for research to pull data from medical offices. In particular, what medical offices will often do is just anonymize any sort of uniquely identifiable information. So the individual's name, or something like in the United States where we have a social security number that's unique to each person individually, that becomes anonymized. But the general demographic data, such as age, gender, diagnostic rate, that becomes shareable. So earlier this year, I did an analysis to see, well, knowing that what we do about the diagnostic differences and how autism can be experienced differently when we start accounting for gender, how has this translated over into research? because the male to female ratio of autism is currently estimated to be between 3-to-1 and 2-to-1. However, in research, it has actually emerged as low as 5-to-1. However, I have also come across instances of a 9-to-1 male to female ratio. And in a recent study, of a meta-analysis, I found a 15-to-1 male to female ratio. However, in another analysis I came across, what was found is that over 60% of the studies that were analyzed in a particular meta-analysis had 100% male sample. So this then raises questions. When we start thinking about this idea of inclusive hiring and creating more equitable opportunities for the neurodiversity population, is that if we start to examine the information that we are pulling the research from and we're observing a male bias in terms of representation, this does have a direct influence in when we start thinking about how to create inclusive classrooms, inclusive workplaces. So, as mentioned, this starts to suggest that autism itself isn't particularly a male-dominant condition, but that our understanding of autism carries a male bias. So when we start to examine purely the role of intersectionality through gender, it really starts to showcase a deeper understanding that we need to really establish a much more in-depth perspective around autism when accounting for these new perspectives of the lived experience through gender. Now, something to keep in mind is that approximately 24 to 30% of the autistic population identifies as gender diverse. This is astronomically higher than the general population, which it currently sits at about 1.3% who identify as gender diverse. So this really creates significant challenges for institutions when we start asking the question of how to best support neurodiverse adults. So, for example, when thinking about some of the workplace practices that have been introduced in recent years, it raises the question of when we start talking about what is considered best practice to employing autistic adults, we have to ask the question, is it actually best for everyone? So thinking about the research that I just shared with the differences that have been observed with male to females and how they display autism and how it's experienced, in a study that I conducted earlier this year, I actually examined whether workplace inclusion is experienced similarly between males and females based on some of the current best practices that exist around hiring and integrating and managing autistic individuals. And what was found is that autistic males found the practices to be much more fair and inclusive, whereas autistic females did not at all. So this was really interesting because what it started to showcase was this point that when we ask this idea, when we start introducing what we consider to be best practice, we really have to start asking new questions to say, is this actually best practice for everyone? So in thinking about this, we're going to transition more into now thinking about inclusion and thinking about how that can be utilized as a solution to kind of help alleviate some of the inequities and differences that exist in the workplace experience. Now, inclusion is a term that many of us have often heard in conjunction with diversity, where it's often projected as diversity and inclusion. And even though we use these terms together, they are actually very different. So, for example, in organizations, diversity is actually a metric of what your organization is comprised of. So for example, many of you might have seen something kind of like some sort of company's annual report where they may talk about the type of demographic representation that exists in their workplace. And you'll notice that it's often kind of presented as they have a certain percentage of gender, then a certain percentage of race, certain percentage of disability or sexual orientation. Now, you'll notice, though, that they always present it from a measure of what percentage that accounts for in their workplace. What you'll never typically see, though, is an organization explaining, well, how do we get these different groups to work together? That, ladies and gentlemen, is the focus of inclusion, where inherently we're moving away from this concept of what the organization is and more of a question of, well, how do we optimize the different and unique talents of a really diverse workforce? So through this, the perspective of the employee then takes on a greater importance by measuring their perceived belonging and belongingness, as well as feeling valued as their true authentic self. So inclusion is kind of really comprised of these two key elements referred to as uniqueness and belonging. So uniqueness is more of this idea that you feel like you're allowed to express your true authentic identity. And that when you go into the workplace or when you go into a classroom, you can just be your true self. Now, belongingness is more of this idea of kind of having an emotional security that we feel that we are socially accepted for who we are. So in thinking about that, something to keep in mind when it comes to thinking about an inclusive workplace is that it's inherently a process. It is not a goal or an outcome. It's something that we psychologically experience. So bearing that in mind, we have to distinguish this differently from diversity, because inclusion, again, is this feeling of social acceptance, whereas diversity is what we measure. So something to also keep in mind when it comes to inclusion is that we have to start acknowledging the diversity in communication and information processing that can take place. So thinking about the concept of neurodiversity, and this is a graphic design that was designed by a wonderful colleague that I mentioned earlier, Dr. Lutza Ireland. So she had to put this illustration together to kind of showcase the diversity in communication styles that can take place within the neurodiversity community. But these are also valid information processing styles. In particular, we often associate smiling, nodding, and eye contact as a very common form of social engagement. However, historically, we've also kind of perceived the opposite to be rude, for example, such as not smiling or not having eye contact. However, what's been found is that these are actually very valid forms of social engagement and participation, especially with information processing, where we may display individuals who may be fidgeting with their hands, or many of us in social engagements or in lectures may sit back with our arms folded, but we're still engaged in what the person is saying. Our body language may just tell a little bit of a different story. Or for some individuals, they may pace and move around. I'm very much part of that category. If I'm ever doing a lecture in person, I am absolutely pacing back and forth. But again, that's just a characteristic of my individual ADHD. Now, there may be instances where somebody may have difficulty finding words or may not necessarily be a natural verbal speaker. That's absolutely okay, because we've also found to be a valid form of information processing through speaking or writing or using visuals. In fact, just a couple months ago, I was in Belgium for a conference, and I heard a wonderful presentation from a startup business out of the United States. And for just a second, I'll tell you this brief story, is that this individual, what prompted her to start her business, which was centered around facilitating a hiring process that was more inclusive for autistic individuals. She has a brother who's autistic himself and is nonverbal. In fact, for the first approximately 15 years of his life, he had never spoken verbally at any stage. So they just assumed he was nonverbal he was just going to be nonverbal for the rest of his life. What was interesting is that one day he sat down and started writing and started communicating electronically. And what they noticed is that he then started writing poetry, which took everyone by surprise. But what was so fascinating, ladies and gentlemen, is that the poetry he was writing was based around his personal lived experience of growing up in a world where he understood everyone around him, but then he was remarking on his experience of how he was then treated or viewed as a result for not responding back in the same degree of what they were expecting. And so it was this very deep, reflective poetry that he was writing that nobody really saw coming, but he simply did it through writing. So most people didn't really notice because they were so focused on the idea that he should be verbally speaking. So the point is, ladies and gentlemen, is that there's a diversity in how we communicate with each other that can change based on age, gender, cultural influence, or the presence of a neurological condition. And it's not to say that one is inappropriate. It's just to say that it may be different, and that is perfectly okay. Lastly, you then have in light of Zoom, we have the idea of whether or not a camera should be on or off. I know when my mom was teaching, that was a big area of focus during the lockdowns, was students had to have their camera on, but it's totally okay to have the camera off as well, because it may not necessarily be an inclusive experience for everyone. So it's so important, ladies and gentlemen, to acknowledge the diversity in communication as well as information processing. Additionally, one thing that I often encourage organizations to do is adopt a strengths-based approach. And this is something that I also do in the classroom. And this is really essential because it starts with recognizing that a natural difference in ability does not equate to having a disability. And that many of us, and like I shared earlier with the spiky profile and the cognitive profile, many of us have a natural area of strength and a natural area of weakness. That doesn't necessarily mean you have a deficit. It just means you have a natural strength and a natural weakness, just like everybody else. Now, additionally, this is really an effective approach in the workplace as well as the classroom. And the reason why is that it really fosters a high degree of motivation, self-efficacy with an individual believing in themselves, as well as engagement. Now, for anyone here who teaches, this is something that I very much apply in the classroom. Typically, what I will actually do through assessments or exams or anything like that, when it comes to providing feedback, I aim for a 2-to-1 ratio in terms of strengths while highlighting areas of opportunity. I will highlight 2 areas that they did naturally well. This may be related to how they express an idea. This may be related to how they explained an idea, or perhaps their argument around something. Or I really aim to find 2 areas they naturally did well with. But then I will then highlight an area that is an area for improvement. And the reason why, ladies and gentlemen, especially in the context of the classroom, is that many of us grew up being told consistently of what we did not do right. When we mark exams, when we mark assessments, rarely do we say, yes, you did all of this right, but you had this one area wrong. It's usually, well, here are the things you missed. And as a result, here's the score you received. So many of us, we don't realize it, but many of us grew up in an environment where we are just constantly told what we're not doing right. When you start telling individuals what they naturally did well, it's going to have an enormous influence on their self-efficacy and their overall engagement in the workplace, as well as the classroom. Now, these types of ideas, I tend to keep a little bit more high level, again, because I recognize there's a diverse group in the audience. So if any of you are interested in wanting to dive deeper more to kind of how you can create a more inclusive workplace or classroom, please feel free to reach out to me directly. I'd be more than happy to share some more insights around that. Now, having said that, thank you very, very much for your time today. I'll be more than happy to take some questions at this time. But again, if you are interested in kind of participating in any sort of research or discussing inclusion on a more deeper level that's unique to your organization, please feel free to reach out to me. But at this time, I'll go ahead and hand it over back to Tim and kind of dive into some questions for everyone.
Great. So thank you very much, Justin, for a really engaging presentation. And just to get the ball rolling as well with some comments and questions, and I guess, I mean, this is the Masterclass series where we explore all things about neurodiversity, but even in more general terms. For example, in nursing, my background is nursing. I am a mental health nurse, and giving a presentation is a skill which has relevance in mental health nursing, because sometimes mental health nurses need to give presentations. And if somebody was unable to give a presentation, you know, sometimes I think we can be very harsh on that person. You know,
Sure.
We can, you know, for example, you mentioned assessment, you know, sometimes the person therefore won't pass the assessment. But by the same token, being able to stand up in front of a group of people and deliver information, for example, about a healthcare condition, or deliver information about a medicine or deliver
Sure.
information about a treatment may be quite important. So I'm just wondering, you know, when it comes to maybe careers and when it comes to areas of work, again, if maybe, for example, communication meetings, handovers, as we call them in nursing, if that verbal feedback is an issue for me, or that verbal communication, do you have any perspective from a workplace inclusion? Sorry, do you have any view from a workplace
Sure.
inclusion perspective? How do we support people, yet we also must recognize that those jobs must be done? How do we support people, but yet ensure that those aspects of the role are carried out? And I apologize for the very long-winded question.
It's quite all right. It's quite all right. I
finding my
really
words.
appreciate
Thanks.
this. I would like to remark on briefly, you had mentioned the idea of a presentation. And especially in the context of education, this can be a very common form of assessment and form of a communication delivery. And I use that as an example just briefly, and I'll touch on the context of the workplace in just a moment, is that I think there's a learning there that we can take to the workplace as well. When we start to ask the question of, there's many practices that exist in the workplace as well as the classroom that we have done for a certain, that we do a certain way because that's the way we've always done things. I think it's important to ask the question if that's still the best way, because it's easy to kind of get caught up in the idea that when we've done something a certain way for a certain length of time, we develop this natural bias in assuming that's the best. And they sometimes, I believe they refer to it as the longevity bias, where the longer we do something a certain way, the more likely we're inclined to believe it's the best way to do things. But that's not necessarily the case. And so thinking about the classroom for a moment, one thing that I've really kind of pushed at the university level is not making it a requirement for students to do a verbal presentation, because that's an exclusionary practice if an individual has a natural difference or a natural ability with information, with social interaction and communication. Rather, give the option to preferring to doing a written assessment versus a speaking assessment, to which one caters to their natural strength more. Because at the end of the day, you're still required to produce the same degree of quality of analysis. It's just the delivery is what changes. And so when we start thinking about this in the context of the workplace, thinking about the delivery of feedback that's maybe provided to a new employee from a manager or supervisor, for example. So I think the bulk of the focus is really kind of thinking about what is the focus there, which is inherently you're wanting to translate feedback to provide a guidance for improvement and growth and development. Written communication has been a very effective form in this regard when we start thinking about neurodivergent employees. And in particular, when you think about it, writing forces us to be a lot more clear and specific with what we're wanting to translate. Speaking, many of us don't realize that it's very context dependent, and that a lot of the phrasings we use can carry more than one meaning. So when we really think about it, say, for example, as something as simple as, how are you doing today? Are you asking out of politeness, or are you asking because you're genuinely interested in how that person is feeling at that point in time? There's meanings to phrases that we often forget carry more, can be very ambiguous. And for a neurodivergent individual, that can be a little bit of a difficult process to navigate, especially when it comes to receiving feedback. So I think writing really kind of offers a form in providing feedback to individuals that makes it much more clear and interpretable. In a 2020 study that we had conducted a global autism study, actually, where we started to look at different practices in the workplace. We looked at accommodations, we looked at communications with the direct supervisor. And what was very interesting, there was a couple pieces. One is, what we found is that both autistic and non-autistic individuals were making the same requests for accommodations to their supervisor. What was interesting is that we just then put the bulk of the focus on the autistic group, saying, well, it's a form of disability accommodation, but then for the non-autistic group, we just saw it as a workplace request. But in reality, once we tested it, we found that both groups were making the same request for both things. And one of the most common requests was directions in writing, because writing provides a degree of specificity that doesn't naturally exist when speaking. And this also extended into other areas as well, with communication with supervisor. And we found differences even for how males and females were wanting feedback. And so I think another element is also just kind of creating that, being able to create a climate where individuals feel like they're allowed to communicate their needs to a workplace supervisor or lecturer or teacher. And also kind of taking the point of something I'll ask students pretty early on is, if you have a preferred communication style, please let me know. Or if you're not sure if you have one, that is also valid to know, because that means we can try different methods to see which style resonates best with them. So it's one of those things where in one regard, it's just kind of it's a idea of being aware of different styles of communication and how we can do it, but then creating an engagement and relationship with the participants, whether staff or students, to be able to find out what is their best way to communicate and most effective way to processing information.
Thank you, Justin. I'll come back in a little while with another question, but
Sure.
I'll hand over to Nicola for now. If you want, you can take down your presentation, and we'll have a look at the delightful waistcoat you have on there.
Yeah, we have some, there's a lot of very, very positive feedback here, Justin. Thanks very much. A lot of people that are really relating to even your question there, Timmy. And so thank you very much, they're saying. We have a question there on disclosure.
Sure. Wow.
Yeah?
Very interesting.
Okay.
Yeah, great.
I know it's a big open-ended one, but this is kind of, it's tighter. So basically it's, would you expect, this is from Tanya, would you expect someone to have received an official diagnosis before, often kind of along the lines of what you were talking about, would you expect someone to have received an official diagnosis before offering to look for the reasonable adjustments in work? I've recently been told my workplace that they won't look into support someone who is self-diagnosed.
Interesting. And thank you very much for sharing, Tanya. That's really appreciated. And disclosure is a very important topic. Absolutely. And it's become one that's what I've seen in the last couple of years is that this actually is starting to vary by institution. For a long time, it was a customary practice to have a professional diagnosis before accommodations would be provided by an organization. This was largely driven through a legal perspective from organizations, but it wasn't necessarily the most effective, nor was it the most inclusive, because as you saw earlier in the presentation, the diagnosis, requiring an individual to have a diagnosis is fine if it assumes that there's an equitable opportunity for everyone to receive a diagnosis or have access to getting a diagnosis. And that accessibility changes significantly by country. The process to get a diagnosis, the time that's required to wait to get a diagnosis in Australia is very, very different than the United States, Ireland, and so on and so forth. Now, in saying that, it's really ultimately up to the organization how they choose to do it. Most organizations I know currently do require a medical diagnosis. However, there are institutions now that I've come across where they are actually doing one of two things. One, they are treating self-diagnosis as valid. Two, there's some institutions I know of where they are actually working with their employees to help them get a diagnosis. To give you an example, IBM out of the UK. I connected with an employee from there who was self-diagnosed for several years, but then their employer helped them get a diagnosis, actually. They helped with, I believe they kind of helped, I don't know the exact details, but I believe there was some assistance in terms of sourcing a practitioner and sourcing a professional. So in one regard, it's ultimately up to the organization how they choose to do it. However, there is an influx, an increase of organizations who are starting to move away from that now, which on a professional level, I believe is essential. The reason why is because self-diagnosis is valid. In fact, in the current study I'm doing, probably about 80% of the participants actually started as self-diagnosed before becoming professionally diagnosed. Unfortunately for many, the diagnostic process and waiting period was about 3 to 4 years. So this kind of really starts to illustrate, if we're really wanting to think about how to create a workplace that's supportive and inclusive of employees, we have to think about the requirements that are being put into place. Because if we have an individual who may be diabetic, are we requiring them to showcase a medical certification for their needs? Or perhaps if, for example, when my mother had cancer, her institution never asked her for a medical diagnosis to ensure she actually had cancer. We would actually kind of look at that and say, that's borderline barbaric. But we also kind of see it as a form of, we also kind of view it as acceptable for other conditions. So we really have to start asking questions if it's the most, when we think about, again, that's a practice that's been a long-standing tradition, but we now have to ask the question, who is actually the beneficiary here? It's not benefiting the employee, it's just benefiting the organization. But is it necessary? And in most occasions, no, because the accommodations that are often requested are very, very small usually. On average, they cost less than $200. It's like either headphones, just change of environments, maybe a certain type of computer screen, you know, very subtle things. So those are, but also, so long and short end of it, it's ultimately up to the organization, but I wanted to share some extra context around that, that a lot of organizations are doing things differently now, and they're having a very, very high degree of success with trying with those new routes.
Brilliant. Well, just to let you know, there is a fairly big waiting list over here. The HSE has rolled out a couple of adult clinics. All right, we are getting there slowly through the public system, but the private system, there's very few adult assessors out there and able to diagnose. There's very long waiting lists. So
yeah.
So I hope everyone listens to you and we get away with actually being able to self-diagnose.
So just another question for you, Justin. This one is from Tanya. Would you expect someone to have been officially diagnosed before looking to support them with reasonable adjustments in the workplace? I've recently heard in my workplace that they wouldn't look to support someone if they were self-diagnosed.
That's just the one I just did.
Oh,
yeah.
I do. I knew, you know, my goodness. I was thinking that one sounded very, very familiar.
Hard in chat to keep up with them all.
That's it.
And questions. Yeah.
So I'm just going to click. That's answered. Great. And okay. So another one here from Tia. For female neurodivergent individuals seeking a diagnosis, is there any suggestion that they might receive the incorrect diagnosis? And if so, are there common diagnoses that arise within the misdiagnosed community, or indeed no diagnosis at all?
Wow, great question. And so it's a couple multiple parts there. I'm going to start with the latter, where it was asked, what are the most common misdiagnoses? Historically, the most common misdiagnosis for females, from what we have observed so far, and this can change by culture and geographical region. However, generally the most common, one of the most common has been ADHD. And that has typically been found to be the most common. Why? It's difficult to say. There is a multitude of reasons. However, ADHD has been by far the most common misdiagnosis, and that's taken place with males as well. Gender diverse individuals, we don't have enough data on to be able to say sufficiently what the frequency would be there. So I wanted to add that because they're not intentionally trying to be excluded here. There isn't enough data. So having said that, it is worth mentioning, however, that may not necessarily be a misdiagnosis either. It may just be one part of the diagnosis. It's something to keep in mind. And I say that because approximately, it's been estimated that about 60% of the autistic population also meets diagnostic criteria for ADHD, which is a substantially high rate when we really start to think about it. And something to also keep in mind is that the genetic phenotype overlap between autism and ADHD is quite high as well. So in one regard, it could be a misdiagnosis. In another regard, it may just also be a co-occurring condition. Now, for the first part, and I believe, and Tim, please correct me if I'm wrong, the first part of the question was how to go about the diagnostic process. Was that correct? Your speaker's off.
On mute. So the first part of Tia's question was, for female neurodiverse individuals seeking diagnosis, does research suggest that they receive incorrect diagnosis? What are the common misdiagnoses, or indeed no diagnosis at all?
Yeah, so I think, if I remember correctly, there was when you first shared the question was what to do if like suspected misdiagnosis. One thing I can kind of share, I'll do two things. I'll first share my personal experience. Is I was actually misdiagnosed when I was an undergrad. I was not diagnosed with ADHD until about 2.5 years ago. And so I was actually misdiagnosed. And when I received the diagnosis, and I've heard of this happening to other individuals as well, think about, the lived experience we offer is really kind of what makes self-diagnosis so valid, is that your experience of having a particular condition is years and years and years versus your time spent with a practitioner is hours. It's not to undermine the quality of the analysis by the practitioner, but it's to elevate the quality of your own self-understanding of yourself and your lived experience and how that's shaped your understanding of any condition that may be present. Having said that, when I was misdiagnosed, based on the diagnosis I received, I immediately knew that was incorrect because it did not align with my personal experience of my own self. And that's what I've actually heard of several individuals saying, well, I was diagnosed with this, but it just didn't feel right. If it doesn't feel indicative of you, and if you personally do not feel that is representative of your experience, I would highly recommend seeking a second opinion. It's not necessarily the most feasible when we really think about the diagnostic process. However, unfortunately, there is a high rate of misdiagnoses that have taken place. This really ultimately varies as well by location in terms of thinking about what accessibility you have to different resources, including medical practitioners and things of that sort. Ultimately, when it comes to neurological conditions, because these diagnoses are often made predominantly through observation, there's always room for error because it's a subjective process at the end of the day. And kind of sharing the experiences of a couple of people I have spoken to, what they have also done is kind of connect with a general practitioner who has a very strong natural interest in mental health, who tends to approach it a little bit more organically to recognize that they may be wrong or that they could be another explanation to things. And so what they did was actually have a general practitioner that they trusted and that they felt comfortable with, that they felt understood their experience, and went back with that diagnosis to say, based on your experience, do you feel that this is representative of my history, my behavior, and everything? If in the event they felt they wanted a second opinion. And a lot of people started that way. And the reason why is that a general practitioner is typically more accessible. Again, they're not a specialist in mental health, so I want to be perfectly clear about that. But it was just an outlet for many to turn to say, I would like a second opinion to see if you feel this is representative of me. If not, they then worked with them to source a new plan to say, how can we go about managing this? So this is one of those questions that is absolutely worth discussing. At the same time, it's a little bit limiting in terms of how to respond to it, because this is heavily influenced by the geographical region one is in, because it kind of also has to think about the accessibility to resources, type of medical access an individual can have, and what types of options they have as a result. But just kind of sharing a few experiences that I've had with different individuals in the United States, Australia, and a couple in Europe. Many individuals first kind of assess it to their own self, and then turn to it more of a medical practitioner that they trusted, who may not be a specialist in that area, but they still wanted that secondary opinion to say, do you feel this is representative of me?
Thank you, Justin.
Thanks for that. There's one more here.
These are some wonderful questions, by the way. I have to give it to everyone. These are just, it's been, I was very much looking forward to this with everybody as it was, but these questions and engagements are just absolutely amazing. So thank you everyone for contributing. It's really just a pleasure to be here with you.
We have one last one from Christine, just to keep you going and give you one out the door. Do you have any specific examples of how workplace inclusion policies might benefit folks of different genders differently? And she says, thank you very much. It was really interesting.
Well, you know, there's an organization I work with out of Chicago. And one thing that they're wanting to do is they have a sizable representation of gender diverse individuals in their organization. And one thing that they kind of I've been working with them for a while, mostly from a research perspective, but recently it's been much more of a consulting perspective. And so we wanted to start to understand, what policies can we implement that will be beneficial to the gender diversity community? So with that, a question like that, you know, thinking about what was kind of shared earlier with best practices, we asked the question, well, is this best for everyone? If the answer is no, and if the answer is, well, how do we make it best for everyone? It starts with kind of really bringing them to the table. So, so I realize this is a little bit different than the question itself, which was asking for a specific policy example. And this really kind of depends on the organization itself. However, and I wanted to kind of use this example first because many organizations are just starting the process to create these policies and think about what is best for everyone. One way an organization has started to go about this is facilitating focus groups on a weekly basis with their staff, where they just bring anyone to the table who's interested in discussing gender in the workplace and what that experience means to them. What that has started to elucidate is a new perspective of what they actually deem as most important from a policy perspective. And this is really something to think about that's interesting, because what's interesting here is that the concept of gender is not ubiquitous across all countries and regions. And this is an organization out of Chicago, which is very diverse naturally, culturally, and it's very prideful in its gender diversity. But there's other cities where it's not like that. So the types of policies that are then implemented in each also change. So they've started implementing focus groups to really kind of be able to create more of an open discussion around how the workplace can be more inclusive. And what's been happening so far, and this has only been happening for about a month, is that they're finding that there's a lot more trust being developed and that there's actually much more of a focus being centered on managers making more time and supervisors making more time to have one-on-one communications with their employees to understand their needs better. And part of it is, and surprisingly, what's been interesting is that there's been a huge focus actually around more of a policy centered on having supervisors and managers and leaders go through a training to understand gender diversity better in terms of terminology, in terms of the kind of what each term means from an identity perspective. And so this is something I've seen a couple other organizations start to implement, where the focus actually centers on the leaders rather than the gender diverse employees, but the focus is centered on how to understand their gender diverse employees better in terms of how to communicate with them and understand their needs. And that's been having a really positive effect so far. And again, I realize this is a little deviating a little bit from the request for a specific example of a policy, but I would share that because ultimately, I think in one regard, we're still learning a lot about what we can do that's best for the gender diverse community. We've been able to identify a lot of wonderful things already, but the needs of gender diverse individuals, from what I've seen so far based on the current research, has changed slightly based on geographical region and cultural influence, based on their personal experience, based on how gender diversity is viewed in that region. But what I would actually start with personally is having discussions, creating an environment where the gender diverse, if you have gender diverse employees, feel comfortable coming to the table and sharing their experiences, because that's going to have a direct influence in the types of policies you shape and develop. And by also bringing them to the table, it's going to make them feel, though, that they're accepted and that they're welcome and that they're playing a significant part in the development of the organization and the types of policies and practices that are introduced. And when individuals have been invited to the table, what we've seen is that it increases their loyalty and commitment to the organization. It also increases their overall work engagement and increases their communications with both their colleagues and their supervisors. So basically what I'm kind of getting at is the policy itself was making them part of the conversation about what policies are best for them, rather than having us decide for them without their participation.
Okay. So, Justin, thank you very much for speaking here this evening. I wish we had a little bit more time, but I guess we better keep on track as much as we can. Hopefully we might get to link with you again and continue some of the conversation, because of course, you know, there is that intersectionality with areas such as race as well, which I think is really important. And sometimes there isn't enough representation of different ethnicities as well in the area of neurodiversity. And of course, as well, I'd love to ask you more about how we manage, you know, situations of conflict when they arise in the workplace. And maybe people might have competing rights and responsibilities and so forth. But we are out of time, so perhaps that's a cliffhanger for next time. But again, just a few thank yous. A big thank you, of course. I think we had over 50 people at one point on the webinar, so that is good for a November evening. And of course, we're also joined by Nicola from ADHD Ireland, and thank you so much, Nicola, for joining.
Thank you, Nicola.
Beth has again, technology has left Beth speechless, but certainly we knew you were there in the background, Beth. And finally, of course, yourself, Justin, who I think has given a real stellar performance, not just in terms of presenting your work, but also your delivery, which was so engaging. So a big thank you to Mr. Justin Carrero, currently studying in Monash University and management consultant. And you mentioned you might be coming to Europe again.
Yes. So first and foremost, I wanted to say thank you everyone for being here, because I realize many of you are going to be jumping off soon. So I wanted to sincerely say thank you to everyone who've attended. I really hope you enjoyed it, and it was an absolute honor to be here, and can't thank Tim and Beth and everyone enough for inviting me and organizing this. This has been an absolute wonderful engagement, and would love to do this again sometime. Yes, so as shared earlier, I was in Europe a couple months ago doing several guest lectures in Belgium, Netherlands, and this is centered on inclusion. This centered a little bit more and diving more into the research itself around gender differences. There was a little bit more information given as to saying, well, how do we create inclusion in the classroom? And so I shared a lot of experiences there about things that I've been trialing in the classroom and what's worked and what has not worked, and the response from students and stuff like that. And so after each of the engagements, the universities had all asked for a follow-up engagement. And so we've actually all been kind of working on facilitating something next year, actually, and kind of being able to partner with several universities and deliver different workshops, actually in person, around ways we can be more inclusive in the workplace. So something that's much more directed towards HR specifically and organizations, but then something a little bit more separate and kind of more informative around gender as well as education. So we've been kind of organizing those and everything. We don't have a specific date yet. We're kind of in discussions around those, kind of finding something that's suitable for everyone. But so that's one thing that we're kind of in the works with, and would love to absolutely extend it to Ireland and have the opportunity to meet everyone in person if the opportunity were to permit itself.
Okay. So thanks, Justin, and we'll certainly catch up on that. We're on a break in December, of course. As much as we'd love to be here for the holiday period, we won't. But we will be back, of course, in January with Sue Johnston, who will be giving a talk as well on maths anxiety, a consequence of neurodivergence. So that sounds very interesting, because again, I'm not sure if the talk is going to relate to dyscalculia, but if it does, I think that would be a really, really interesting topic to cover. So that's on the 26th of January, and see you then. Thanks, everyone.
Thank you, everyone.
Bye-bye.